Welcome to Leveraging the Laboratory, a Mayo Clinic Laboratories podcast for administrators, outreach managers, and laboratory professionals to learn how best to leverage and optimize the laboratory for patients, clients, and staff. I'm your host, Jane Hermansen, Outreach Manager at Mayo Clinic Laboratories. And joining me today are Dijkman Dulkes and Wendy Daigle, Outreach Solution Strategists within Mayo Clinic Laboratories. Our discussion topic today is about outreach program communication, but we're going to focus mostly on the internal aspect of the communication and communicating truly about the outreach program to our internal laboratory departments and building a team with those who perform functions that are critical to the outreach program. This is key to success. And from an outreach leader's perspective, I see running an outreach program kind of like conducting an orchestra. Many different groups, many different individuals have to come together to create a coordinated service. And you trust that they each play their parts correctly, seamlessly every time. And communication is key to making all of that happen. But before we launch into our topic today, I want to take a few minutes and introduce our Mayo Clinic Laboratories outreach team. So you probably know me. I'm Jane Hermansen. I'm a medical laboratory scientist by background, and I started my employment at Mayo Clinic in 1988. Yes, a long time ago. 30 years ago, in 1995, I left the testing lab and I joined the reference laboratory department, and I have been part of Mayo Clinic Laboratories ever since. So that's me. Ellen, why don't you tell us a little about yourself?
Hi, Jane. I started at an academic medical center in New Hampshire decades ago. I'm only 29, so I don't know how that happened, but I taught and trained many technologists in blood banking and chemistry and hematology, and I ran a med tech program. And I was an outreach manager. I was a client of Mayo Clinic, and my dream job, Jane, was working for you. And then I retired from there and started working for Mayo, and I've been with you for 4 wonderful years, Jane.
4 wonderful years, absolutely. And Wendy, 4 wonderful weeks. We're going to introduce you. So welcome to the team. Tell us about yourself.
Well, thank you, Jane. I'm so excited to be here. My background is business administration and management, and my career in the lab began as an outreach account manager over 20 years ago as a Mayo client. From account management, my scope eventually evolved into having courier oversight for both internal and external couriers. I was involved with the lab client supply fulfillment and delivery processes. I managed a customer service call center, and I've done outreach business development and marketing. For 18 years, I was at a large healthcare system on the East Coast that services Boston and its densely populated surrounding communities. That health system has academic and community hospitals, and I worked at 2 of their community hospital laboratories. And then more recently, I was with a growing Midwest healthcare system with over 17 hospitals and 77 clinics, servicing rural health populations. And that was across a very broad geographical area covering portions of 3 different states. So each healthcare system had some similar but very different outreach environments. So I'm very excited to be here with you now.
We're super happy to have you on the team. So thank you so much. And just for our audience's benefit, I want you to know, in addition to the 3 lovely faces that you see on the screen today, we have a whole team of experts within Mayo Clinic that we work with to support our clients' outreach program needs. So truly, if I were going to say it in short, if you've got a question or a need, we have somebody who can help you. So let's get started on our communication topic today. So Wendy, we're going to start with you, given that you've got experience with a number of different lab outreach programs. As an outreach leader, what departments within the laboratory did you work with the most?
Oh, sure. So on a daily basis, it was primarily the lab service support departments that interacted with our clients. That would be couriers, phlebotomy, specimen processing, lab billing, and supplies. And then more on an as-needed basis would be IT. Maybe a client was having issues receiving a lab report, or they may be interested in having an interface created from their EMR system to the lab. And then I would also work with the core clinical lab departments. If I needed to understand a client's testing issue, or they had a question, or perhaps a client communication regarding a lab test or supply change needed to go out to our clients, I would work with the lab manager and tech specialist for the given lab department to send out those client communications.
So that sounds pretty broad. Were there any departments you didn't work with?
I would say I've really interacted with all the lab departments, some more than others. Maybe to a lesser degree was pathology outside of PAPS.
Got it. Okay, perfect. Well, Ellen, I'm going to kind of flip the coin a little bit. So Wendy talked about the internal departments. I know you have some good experience with support departments outside the organization. So from your perspective and experience, what are some examples, Ellen, of outreach departments and support areas that are found externally?
Yeah, the biggest one that I worked with and really worked with extensionally was the courier. They moved specimens all over New England. They were integrated and had contracts with different big organizations, but they were integrated at our organization in New Hampshire, and they moved things for other ancillary departments, and they had the whole scope of business. So I had to make sure that our laboratory specimens were not integrated with other departments, and they were laboratory dedicated routes. We had an external billing department. And so that had some hurdles, and I had to make sure that I had the metrics and made sure my clients were paying. And then marketing was outsourced. So, how do you manage a marketing strategy with an outsourced billing department? I mean, marketing, billing, and courier. So, yeah, it's got its own little hurdles right there.
Absolutely. So from your perspective, how do you think an external department differs from the internal partners that Wendy talked about?
Well, I think the biggest one is you really need to define the statement of work and set clear expectations of what is your brand, who are you, who do they represent, and what's in scope and what's not in scope. So really having a contract, and equally, what are the terms of that agreement, and your clients know who they are and who they represent. So, with the courier, for instance, when we were transitioning, I really had an onboarding PowerPoint presentation that I met with all the drivers. And it was a Saturday, and I presented it several times that the drivers came into the laboratory. I gave them a tour of the laboratory and went over basically, yeah, these aren't widgets and these are specimens, and you represent our brand, and why you can't show up a half an hour early, and why you can't show up late, and why the doctor may be late getting specimens. And so really did an onboarding, and it was an ongoing every annual event to really keep that flywheel going of education. And how would you feel if this was your child or your kid's specimen that wasn't at the right temperature and grandma needed to be redrawn? I think having a relationship with an external partner, that they become invested in your brand, makes that relationship stronger. And then having key people that are the go-to people. So not everybody from your organization is calling that vendor. Having key people, me ideally, or a dedicated person that handles those problems, I think is very good for mitigation of those troubleshooting issues.
Perfect. So those are relationships that you kind of started with. You started those relationships. You had to build those relationships. If you were a brand new outreach manager in an organization, what would you recommend as the best approach to establishing those relationships with existing external partners? So you're hired brand new, you don't even know the lay of the land. How do you start out getting those relationships?
Well, I think it's really, if you're brand new, lay of the land, I think that's the perfect landscape to find out how that courier vendor views your organization as well. Because, it's a 360, right, Jane? You may think your lab is doing a bang up job, but maybe that vendor is equally, I don't want to, use some bad words, but maybe they're not too happy with your shop either. Maybe they can't get access to your buildings, and maybe your security group, or maybe this, maybe that. So, I think I would not assume anything is broken, and maybe not everything's perfect. And I would start to really do some homework of talking to key stakeholders internally, key stakeholders externally, and then start to really build those relationships of finding out who, and really start formulating what is best practice, and start to really look at the metrics of a courier. How are the KPIs? How are the customer satisfaction surveys? And then for billing, who's paying, not paying? Look at trends. Are we collecting? Is the billing department able to provide who's paying, not paying? And is your billing department calling the customer and sending them to collections? Well, heck no. I want them to be calling me to find out maybe they have the wrong address. Nursing homes are getting sold uh, quite quickly, and I've had it where they send a bill, they send a bill, they send a bill, and they just never had the right address. So I think setting up regular meetings, and I would do that, quite regularly. Let's go over a statement of accounts, and really bring that to my operations group to say, hey, what are the problems with this client, and really do some proactive management in alignment with my billing department, in aligning with my courier. What are the issues with that troubled client? I think being proactive with those external customers and not just thinking it's going to take care of itself can be very helpful.
Sure. So just kind of asking some good questions and then finding out what they think of you. I love that idea. Okay, Wendy, I'm going to flip the same question over to you, but we're going to do it more from the internal perspective. So as a brand new outreach manager, you come in, how do you build relationships with the internal departments?
Sure. Great question. So what I found is first, if I can get some time at a departmental meeting to introduce myself, explain my role, and understand how I can best support their work in my role as I'm out and about with the clients. And then I like to get the opportunity to shadow in each of the support area departments, because it's very helpful to learn about the client related struggles they may have. I can ask them questions, they can ask me questions, and really by seeing things from their perspective and workflow, I keep that in mind as I'm interacting with the clients. And when staff do start to come to me and have to identifying issues, I found that, don't make assumptions in what the right answer is based on my experience. Really involve them in the solution. I found that to be the most effective way to minimize the occurrences. And then that way I'm really understanding the issue, and the staff is providing me the specifics of what they would like to see from the client to ensure that there aren't going to be rejected specimens or delayed testing because something is missing. And then making sure once I do talk with the client, providing the lab staff with timely follow-up. And even better is when we can track the issues and let both the client and the staff know if their educational efforts are paying off. And then when possible and appropriate, having a processing or phlebotomy lead come with me on a client visit, really as the lab kind of technical expert, it's a great resource to the client for asking questions. And it helps the lab lead to see things operationally from the client perspective. A lot of times, we can get caught up in lab world and not really kind of consider some of the challenges that a client may be facing. And once you're aware of that, it's just great synergy to kind of work together to how we can incorporate that new insight into client educational materials. And it results in fewer recollects, better patient care, and improved client and provider satisfaction.
So what you've really done, you're talking about kind of walking a mile. Ellen talked a little bit too about walking a mile, but those things really help form, I think, openness, trust. They see you as a person, not the enemy. And one thing that I see a lot of is just that outreach programs don't seem to be as recognized as part of the laboratory. Laboratory says we're here for inpatient. This outside stuff is just kind of a hassle. We'll set it aside until we have time to deal with it. And oh, oopsie, now by the time we have time to deal with the specimen's timed out, you have to reject it and recollect. So I think that that whole communication, and I'm on the same side as you, is really going to help a lot. So that's kind of from the perspective of kind of coming in fresh and taking inventory. How about when you're not the new kid, but now there are new managers of outreach support departments in the laboratory? So Wendy, I'm going to stay with you since you're talking internally. What do those new people need to know? You talked a little bit about kind of taking some of those folks out on the road with you, but tell us about any other thing that you've done to help educate new managers as to the outreach program needs and how they can help support you.
Great question, Jane. It's so important to have dedicated time with the new manager to talk about the outreach program. They may not be aware of what an outreach program is, may not have had one at their previous hospital, if they're even coming from a hospital. So it gives me the chance to explain how it supports the continuum of care in a way that the commercial labs can't, which in turn supports the growth efforts of not only the lab, but the hospitals as well. And then I like to provide a client overview, the size and the scope that includes our service area, what type of clients we have. It could be physician offices, skilled nursing facilities, other hospitals, visiting nursing association, and what's important to each client type. Who are our biggest clients? And how does that new manager's department support the overall effort for effectively servicing our clients and giving them a heads up of any historical issues with a given client to be aware of related to their service support area. And lastly, how I can support their efforts, bringing feedback to the appropriate client contact, providing client education, and determine how we can best communicate with each other when there are issues, changes, or client communications needed. That really takes a village, and how we can work together to really provide excellent client service, customer service. And patient
Excellent. So
care.
you've really built that team, right?
Right,
So Ellen,
absolutely.
oh, go ahead.
No, go ahead, Jane.
Oh, okay. So Ellen, I'll switch over to you. So when you have some new staff within an external partner, what do you do to re-engage those new people? They don't know you, you're their customer, but they don't have a clue. How is it similar to what Wendy's doing? How's it different?
Well, I think it's pretty much the same way. I really like the idea. Actually, I do it quite what Wendy does. An external partner really can go silent on you, right? It's really hard to have them top of mind, So I really try right off the bat is to have regular meetings set up quarterly. And even if the leader or the person you're talking to changes, then you've already got a meeting on the calendar. It's that continuity. And I would always bring somebody with me. So I meet with the billing folks. I meet with the billing people quarterly, and I will bring the business manager from the laboratory with me, and because they talk to their peer person or the courier, I may bring somebody from the call center or, so I bring people with me. And I was just, as Wendy was talking, I just had an epiphany, about internal. And I hope I can just go back to what Wendy said, because I'm thinking about the work we do, Jane, to talk with our clients. We often get new salespeople and new people to our division, and we have a hardwired training program of the work we do for our customers. And we're continuously getting together to showcase the work we do to support our clients, and it's just hardwired. And I think having things and processes that are hardwired. But meeting with external clients, I think if you have that hardwired as well with like metrics, clients that are paying their bills fulfill. It doesn't matter if the people change, the data and the metrics. If you have to report them to the operations and the quality council of the lab, it doesn't matter if the people change because you're still going to need the data. Do you know?
Mhm.
So
Yep.
I think that's really healthy to just have a standing meeting cadence. And the other thing I would do is to pull those external partners together in like a stakeholders meeting, an outreach, dedicated outreach meeting, where I would have the medical director and I would have the admin director of the lab and I would have maybe the courier come in, and depending on the topic of the agenda, I would have those external partners. I would have supply chain come in and we'd have a discussion over just outreach topics, new business, losing business, and just have a topic centered around outreach for the lab.
So I love that. And I think when you talked about how we educate our internal partners at Mayo Clinic, very, very true. And one thing that I've learned is just because we taught them once doesn't mean they learned. And it's kind of like dealing with teenagers. You have to tell them several times. And honestly, you can train them, but until it matters to them, they don't know. They
Right.
don't remember. So it's one of those things to understand, to be patient sometimes, because no, they're not going to remember. You can roll your eyes and say, I already told you that. No, we're all about trying to improve relationships, not make them feel bad. So one area we talked a little bit about is just kind of those non-laboratory departments that are also involved in the outreach program. And this could be anything from registration to compliance to the facilities department to parking and legal. Ellen, just one last quick thought. What kind of thoughts do you have about building relationships with those other areas? They're maybe not as involved, but still important.
I always attended morning huddles. If your lab has a quality huddle, I know that some outreach people don't go to the morning huddle because it's based on operations. I always went to the morning huddle because then I heard about the customers that, those specimens, I want to say the evening dump of specimens when they come in. I always went to morning huddle because I heard the morning dump from client XYZ that is 80% of the trouble, comes in that evening dump. I wanted to hear what the issues were coming from Dr. So-and-so practice. So I always went to the morning huddle. The morning huddle told me about the specimens, the coag tubes that were in shortage. I always pick something from operations morning huddles because that is what is going to affect my clients, right? When there's a communication message that comes out from the pathologist about a change or downtime, anything, that was all valuable information that I needed to tell my clients. So I think morning huddle is incredibly important. Leadership huddles, new tests coming in, all that stuff that I mentioned, incredibly important. And I already talked about an outreach meeting because I think that is so important, especially if I went to one system meeting. They have it every morning and all the system leaders call in and it's like a morning huddle on steroids. They all call in 9:30 every morning and every system partner calls in. And I think that is brilliant.
Awesome. Love it. Okay, Wendy, I'm going to talk about a very nuanced area that can be a real challenge or it can be great. How about communicating with those within the organization who can help make your lab outreach program more visible? I'm thinking kind of along the lines of marketing or your website, because those are things, they're not sitting at the lab general huddle, right? But boy, if you don't have them, you're not able to get your word out. What are your thoughts about that?
Oh, sure. So with marketing, really understanding who your go-to people are and making friends with them. What I've found is marketing, like the laboratory, has many departments which focus on certain tasks. So there may be several key contacts you can develop relationships within the marketing department. So, what I would first do is reach out to the manager, introduce myself, kind of talk about what I'd like to achieve to promote lab services and understand what their offerings are, what offerings are that could potentially be helpful in supporting outreach. And that might be, internal and external communications, provider lists that I don't have, access to. I don't have to recreate the wheel, trying to create that myself. Printed materials, their marketing is very, very creative. They can suggest a lot of things that I hadn't even thought about or that they've done with other departments to to promote services. Website content, that's really big because information is constantly changing and you need to update things. And they can help you connect public websites, there can be internal websites, but there could also be multiple public internet sites that could be accessed by different users, a patient versus a potential person looking for employment with the laboratory, or with a client that is an external client that doesn't have access to the hospital's internet site, and making sure that those websites are all connected, so that they can the information is connected, and those relationships these relationships with marketing also keep the lab on marketing's radar for opportunities marketing can come across that may be a good fit to do a lab feature for. And then also what I found is I needed to understand if there was something I needed help with from marketing. I really needed to understand kind of what their process was when I have a request, how to submit a request, what happens on their side when they get a request. Is there a review process? When is that? When can I expect to be contacted? Just so that my expectation for turnaround time is more in line with that. I know what to expect and I'm not bugging them because they haven't gotten back. And in a couple of days, they might meet once a week to review requests. Then at that point, they determine priorities, and then the follow-up happens. So just kind of understanding what their process is, and then having, when we're ready to do the work, having really well thought out content in advance to provide them, and then quickly responding back to their questions, I found makes things a lot easier for them because they have so many other hospital departments that they're servicing as well and have projects for. And then after the project is completed, really taking the time to show appreciation for their help. My last healthcare system had a really nice company-wide recognition system where we could send an e-note of thanks to a fellow employee. And I'm not sure, but I think maybe even the manager was copied on that. So, at the very least, a quick email, but if there's something on a broader scale to recognize them, really letting them know what a great experience I had with working with them went a long way in building those relationships.
Perfect. Wow. Nice job. I think I'm jealous because it sounds like you had a great way of establishing those relationships. Well, guess what, guys? Time always flies when we talk about something that we love, outreach. So you also know that I like to ask a rapid fire question to kind of sum up our conversation. So I'm going to ask just the same question for both of you. When you think about communicating with internal departments about your outreach program, what 3 things do you think are most important for them to know? Wendy, you can go first, and then Ellen after you. 3 things most important about your outreach program you want your support departments to know about.
Sure. First, outreach is vital for supporting the continuum of patient care outside of the hospital. Second, the additional volume to be gained through outreach contributes not only to the growth of the lab, but the hospital as well. And third, it really takes a village to provide excellent customer service and patient care. And with strong collaboration and communication across the lab team, we can really stand out from the commercial labs by providing excellent lab services on the local level to our clients and patients. And clients and patients have a choice for where they send and go to for their lab work. And at the end of the day, we want to make that choice for them to be easy and for it to be our hospital laboratory.
Yep. Awesome. Ellen, how about you?
I couldn't say anything better than what Wendy said. And other than I would correct you, Jane, and say it's not an orchestra, I would say outreach is like herding a whole lot of cats internally and externally. And I would only add to Wendy's that I would tell internal people to visit your local laboratory and see how awesome they are and recognize them during lab week. Other than that, I think Wendy
Absolutely.
hit it out of the park.
Perfect. All right. Awesome. Well, Hey guys, thank you so much to both of you, Wendy, Ellen. I think we learned some great ways to engage with internal partners, external partners, and establish those good relationships working with them. Your expertise is fantastic, so thank you again. And for our audience, if you have a question for the Mayo Clinic Laboratories outreach team, please email us. We have our own email address, mcloutreach@mayo.edu. Who knows? We might even use your question in our next podcast. And thank you for listening to Leveraging the Laboratory, a podcast from Mayo Clinic Laboratories. If you've enjoyed this podcast, please subscribe. And until next time, we encourage you to continue to promote your community-based hospital laboratory. The needs of the patient come first.